Candidate Christie would change the current state law to allow health insurers to select mandate-free policies which could, among other things, cut mammogram coverage in health care plans across New Jersey. His proposal would turn back the hands of time on the progress made in women's health care over the last 3 decades.
In 2004, New Jersey passed a law requiring insurance companies to pay for doctor-recommended mammograms for women younger than 40. This law received overwhelming support, and I was proud to be a prime sponsor of this bill. The law was strongly supported by the American Cancer Society. Even the Courier Post editorial said, "It is about time."
My life was saved by a mammogram. In 1995, a mammogram found a tumor so small it was the size of the tip of my little finger. I had no lumps, I had no bumps, I had no symptoms of any kind, and as far as I knew at the time, I had no family history. There were many gray areas in 1995. At that time, insurers were not covering for mammograms for anybody under age 50. I was 43 years old. So I had to fight to just get a baseline mammogram at age 43. When I did get it, they found cancer. Now my cancer was so aggressive that I was told by the time it would have formed a lump that I could feel, which is usually about 5 years, I would have had cancer everywhere. I often wonder where would I be now, or if I even would still be here to fight the fight had my cancer been allowed to lay in wait like a terrorist in my body all those years.
Thursday would have been my mother's 79th birthday. She died over 20 years ago from cancer that precipitated from breast cancer. The medical industry has taken great steps to help women to live healthier, longer lives. Why should we take a step backwards as women? Mandate-free policies mean many different things to many different people. To us women, this is personal. And this is a personal attack, and I find it very distasteful and very, very unnecessary for Christie to just arbitrarily say that this is not meaningful.
First, he committed to reducing the reproductive health choices for New Jersey women. Now he wants to allow health insurers to skirt responsibility and not pay for doctor-prescribed mammograms for young women. Christie's plan would prevent women under the age of 40, could prevent women under the age of 40 with a family history of breast cancer from receiving crucial screenings for breast cancer. That would ultimately pass that financial burden from the health insurers to New Jersey women, thereby limiting their access to quality care. New Jersey women should not have to shoulder or bear the cost of doctor-prescribed critical health care procedures like mammograms. This type of policy would leave millions of New Jersey women without any real and appropriate health care coverage. It is unconscionable that Christie wants to line the pockets of New Jersey's health care insurers at the expense of the health care of millions of New Jersey women.
We've worked really hard over the past 4 or 5 years to make sure that women's health care, specifically reproductive health care, is covered as any other health care is covered. Governor Corzine has been a huge advocate on our behalf and on the behalf of women across New Jersey for that. And to have a candidate for governor come out and say, as Christie did, that these are just extravagant benefits is truly offensive. You know, you are talking about mammograms, you're talking about basic contraception, you're talking about cancer screenings, you're talking about things that the legislature had to come in and mandate because insurance companies would not. These are not extravagant benefits in any sense of the word.
Far from a luxury, mammograms are a necessary tool to catch breast cancer when it is still treatable. Early detection can save lives. Although mammograms are a key weapon in early detection, the unfortunate truth is that many insurance companies would refuse to pay for screenings for women under age 40 for sure, and even over age 40, if it wasn't the law.